Good afternoon, everyone. Welcome. I'm Jennifer Moss. I'm the Executive Director of the Ear Research Foundation. One of the components of the foundation is to provide community education so that the public can be aware of the various treatment options for hearing loss and balance disorders. We're going to be talking about one of those today. I would now like to introduce our speaker, Dr. Herbert Silverstein, the President and founder of the Silverstein Institute and the Ear Research Foundation. Dr. Silverstein has been a leader in the field of neurotology his entire career and is the inventor of many surgical procedures that have improved the quality of life for many individuals and patients. He has authored 245 scientific papers and 6 books. His latest innovation has been to develop a minimally invasive surgical procedure to reduce the symptom of severe hyperacusis or noise intolerance. Please welcome Dr. Herbert Silverstein.
Welcome, everybody. How many of you are our patients here? Okay, great. And I want to thank you all for coming and to hear this story about hyperacusis. The Silverstein Institute was built in 2003, and we've been here now 13 years. And the building is holding up very nicely, and we're very proud of it. We have doctors coming from all over the country to see our facility. I have no financial relationships to discuss today in medicine. Whenever we give a lecture to anybody, we have to talk about whether we have any money invested in the product or anything that we're doing. So we have to tell you about that. So let me tell you a little bit about hyperacusis. And there are actually 4 types of hypersensitivity to sound that we have in the ears. And the first one is the most common. It's called hyperacusis. And what this is a reduced tolerance to normal sounds like you'd hear in a restaurant or in a movie theater. And it affects your life where you have to put earplugs in your ear and you're afraid to go to places where there's noise. We have a questionnaire that patients fill out with various questions about this, and this questionnaire is usually abnormal. It shows that a patient has many problems with hyperacusis. We then do a test on their hearing, and usually, sometimes they have a hearing loss, sometimes they have normal hearing, but the other test that we do is called loudness discomfort level test, and it's called LDL. And all our patients get that before and after the procedure. And there's a definition that if you can hear if sounds bother you below 90 decibels, then you're qualified as having hyperacusis if you have it in 2 or more frequencies. Many of our patients are having sound bother them at 60 decibels, 70 decibels. When I'm talking to you like this, we're at 60 decibels. So many of the patients have a lot of discomfort with small amounts of sound. Now, the conventional treatment up till today has been what we call tinnitus retraining. And they use pink noise, and it takes about 6 months. They put noise or sound into your ear and try to get your ear accustomed to listening to sound. And many times that doesn't work, and patients want to have something else done. The second type of hypersensitivity is called recruitment. And this is real interesting. This type of sensitivity usually seen in patients with Meniere's disease or with hearing loss that they already have. And what happens is they go into an area where there's, when the sound is increasing in level, it gets to a certain level where their hearing loss is, and all of a sudden they have a sudden increase in sound in their ear. and it could be any sound. It's not the normal environmental sounds. So we call this recruitment. And again, this is treated the same way as the patients with hyperacusis with TRT. Certain patients have hypersensitivity to specific frequencies. And this is commonly seen in autistic children. And they use what we call auditory integrative therapy, or AIT, to try to get them over this. And then the last type is phonophobia or misophonia. And those patients can have that with hyperacusis also. And the phonophobia is your fear of sound. You're afraid to go any place where there is sound. Misophonia is just you don't like the sound. You remember when the teacher would put chalk on the board and it would screech and you'd feel, oh, a little funny? That's a dislike of sound. And in this case, the LDLs are normal in these patients. And some of these patients may need some psychotherapy. So some years back, we thought that there was maybe hypermobility of the little bones of hearing, or hypersensitivity of the cochlea or the inner ear to sound, that allowed patients to have this problem. And we thought that if we put tissue on the windows, the round and oval window, this may reduce the sound vibrations and reduce the patient's symptoms. Now, our first star patient is here today, which is fantastic, Mr. Schrock, and he'll tell you about his situation. And he was the first patient back in 2009 or 2010 when he came in and complained of a problem after having trauma to his ear. And we put tissue in there, and he was much better. And he'll tell you about that. But we went through the literature to try to find other people that have done this operation, and we really couldn't find anybody. There was one patient with hyperacusis in England that had a fistula of one of the balance canals, and a surgeon closed both windows, and that patient was better. But that was not just plain hyperacusis, that was with other symptoms. And so there's really no other reported literature talking about this procedure that you'll hear today. And I told you about William Schrock, and he'll tell you about this a little later. Now, the second patient occurred 4 years later. I was looking for patients for all these years, and actually I'd forgotten about William, and I almost couldn't find him in my database when our second patient, Carol Kress, came in. And she had hyperacusis for years, and it impacted her quality of life, and you'll hear from her. And after the right ear was done, she asked that the left ear be done. And most of the patients have been asking for the other ear to be done. And she'll tell you about how that's affected her quality of life. So the purpose of this study, what we're doing is we're trying to evaluate this procedure on a group of 20 patients. And we're trying to reinforce the windows with this little piece of tissue that we get from the ear, from where the tracheal area is. And we take a little piece of tissue that's over your cartilage. It's like just a hard tissue, and lay it down on the windows. And this study has been approved by the hospital IRB, which is very important. You can't publish anything today in the medical literature without having institutional review board approval. And so that the hospital has a group of doctors and people that make sure that the study that you're going to do is not going to hurt anybody, and that and they approve of it. So we do a hearing test, an LDL test, and we also do a CT of the temporal bones so that we can make sure you don't have any of these fistulas or some other abnormality. We have you fill out this questionnaire, and also have you fill out a tinnitus handicap, because a lot of patients have ringing in their ears with this. Now, how many patients here have hyperacusis? Just raise your hands. How many patients have tinnitus with it? So you see it's very common to have it with it. And then we have patients fill out what we call a hospital anxiety and depression scale, or a HAD test. And if we didn't want to take patients that had a lot of mental problems and do the study because it may affect the results. So we obtained the measurements we were doing the measurements at 1 week after we took the packing out, but now we're doing it at 4 weeks and 24 weeks and 52 weeks after the surgery. We evaluate the patients, we have them get the LDL test, fill out the questionnaires, and see how they're doing. So up to now, we have 8 patients that have been treated with 12 years. 2 patients have recently been operated. I just removed the pack from a patient downstairs while I was a little late. And so we're waiting on those patients to add those to the study. All the patients have reported subjective improvement in noisy situations, and a good result occurred usually after 1 year was done, which I found very interesting. All patients asked for the second year to be done, and no hearing loss. The thing that was very interesting is that I didn't put here is that we have several patients that have had pain in their ear with a hyperacusis, which is very interesting to find out that their pain has gone away. And so when we did the hearing test, we found mild hearing loss in a couple of patients that really, they didn't recognize it and it really didn't affect them. And the LDL was improved in every patient. So they were abnormal, like 60s, 70s in the beginning, and then after putting the tissue in, they went to 90 and 100, and they became into the normal range. So like I said, the first year had the best result. And like Mr. Schrock will tell you that he's now a 0 now. Over the 4 or 5 years, it seemed like he's improved over the years, which I'm expecting that the patients will continue to do better over time. Unfortunately, we're not able to help the tinnitus. Patients still going to have tinnitus, and what we have for tinnitus today is a masking device we call it the WideXN. It's a hearing device that plays chime music in the ear, and the patient can control that, and it relaxes them, and many patients seem to like this type of masking. We had one patient that we operated that had misophonia, and he was sensitive to certain sounds. His LDLs were normal, and the surgery did not help. So we're not doing any more patients with misophonia. And this is the first paper that we wrote. This just shows you the picture of the surgery. This is the tragus here, right in front of your ear, this little cartilage piece. We call that the tragus. And we just take a little tissue from that cartilage, and we take that and we put it in the window here. And I have a video of the surgery that I'll get to you that you can see after we talk. So that's the story. What I want to do now is I want to bring up 5 patients that have had this procedure. I'm going to have them sit up here, and the rest of the time you're going to spend with the patients. You're going to hear what they have to say. What I'd like you to do is just pass this microphone down when I ask you a question. I'm going to ask you each a few questions, and then I'm going to have you each come up. So, Iona, do you recommend the procedure to help you cope with the noise in your environment?
Most definitely.
Okay, pass it to Mr. Schrock, and we'll see. William? Same question.
Yes, it's helped me tremendously.
Okay.
I was really happy with the results. I would recommend anybody to have it.
Okay.
Even if it didn't work for you, at least you tried something and it was worth it.
It definitely helped me, and I would recommend it to anyone.
You can ask my wife, Rose. Mine worked so well. I said, maybe I shouldn't have the right one done. And she said, oh, yes, you are.
Okay. So why don't you hold that there, Larry. Tell us about what percentage improvement do you estimate that you had? About what percentage?
That's a hard question for me to answer. What I do know is I carry a mail bag, and I've always had earplugs in there, which I don't use anymore. I used to have speakers all around my chair and to watch television, which I don't have anymore. I wear my hearing aids all the time now instead of taking them out when I go to a noisy place. So it's got probably helped me 100% or
All right.
better.
Okay. Carol, what do you think?
It is a very hard question to answer, especially if you have tinnitus, because that's, you know, some of your symptoms remain the same.
Talking to the
but-
mic, Carol.
But I would say 50%, 40 to 50%, it's,
40 to 50%, okay,
yeah,
good.
something
All
like
right.
that.
Well, it didn't help me 100% because I was always hearing things too loud. I never really understood as a child what was the problem. And I didn't like my mother very much, but then when I got older, I realized she was so loud. So I think she may have had the same problem, but things were always loud. So I would say about 80%.
Okay. William?
I feel it's given me 100% because I'm just, it's fantastic. It's just fantastic.
I believe it's fantastic also. It's hard to judge. I'm not quite at 100% yet. I would say it's 85% at least, because a lot of my friends tell me more so than I notice, which is really, really, really nice to know.
Was the procedure painful?
No, it
Okay.
wasn't. I had very little pain. I took 1 or 2 Tylenol after each surgery, and that was about it.
Would you have it again done?
Oh, yes,
Okay.
yes. It was definitely worth the pain,
Okay.
or what little pain I had, it was definitely worth the results.
Okay, William, what do you think? Painful and?
I
would you
really don't realize the pain anymore. I don't even remember having any pain. It was so, you know what I mean? The hearing that I got out of it is so much better than I've ever even imagined before. And of course, it's been years now, and it's just phenomenal. I don't believe it happened. You can hear so good now.
I didn't take any
Okay, I got it.
Tylenol. I didn't
I
feel
got
any
it.
pain.
Okay.
I had very little pain. I think I took 1 tablet, and that was it.
Would you have it again? Would you have the procedure done again?
Definitely had it.
I had my surgery done last August, and we left here. There was no pain. I never did have any pain. They gave me something when I left here. I took two Tylenol at noon when I got home, just because I thought I should. I took 2 more that night because I thought I should, and I haven't had a thing since. This was easier than going to the dentist.
Was there more noise tolerance after the first surgery? Or how much improvement did you have after the first surgery?
Oh,
Just the first year,
well, it's been 6 months, and I noticed a big difference right away.
right? Just from the 1 ear being done?
Just from the 1 ear.
Yeah.
And the tinnitus that I have in my ears, sometimes I don't hear it at all, but today I happen to be hearing it. So I don't know the connection there, whether it's because I'm nervous coming here or what. But
All right, give it to Carol. 1 ear, Carol.
I think both of, I think I had the most, I noticed the biggest difference after the first surgery, although I did feel even better after the second. And I still question, you know, when you ask how much of a difference has it made, and I say 40 to 50%. It's more than that, but it's very hard to put a number on that.
Okay, all right.
I kind of forgot the question.
It's just the first year, how much improvement? Was there a lot more improvement with just 1 ear being done?
Oh, yes, I noticed there was improvement, and I knew I wanted the second ear done. Yes. I don't know about
Now,
percentage.
William doesn't have to answer this because he only had 1 ear problem, because he only had 1 ear traumatized.
We gotta skip you. I noticed a lot of difference after the first ear. I would say because the day before I had the first ear done, I had no ears done. So I was really bad the day before the first ear, and after the first ear, and before the second ear, I was already partially cured. So when the second ear came, it didn't seem like such a drastic result, because the first ear had already cured some of it.
How long was it before you noticed improvement in noise tolerance?
Well, almost right away when the packing came out.
Okay.
Almost
All right.
right away. Although it was kind of interesting with the packing in there, it was kind of nice because I couldn't hear anything.
We're cheating there.
It was, and I've come to realize, as much as the packing might have been a little bit of discomfort, it kind of gave my brain a rest, kind of like a rebooting of your computer. It kind of gave my brain a rest from all the noises, and when I got the packing out, that I could slowly get used to noises again.
Do you think over time it gets better or not?
Yes, it does, and I just heard from William here that give it a few years and it'll get really much better.
Okay, great.
So I'm really hopeful now. Thank you,
Okay.
William.
Okay, Bill. Pass it on, Ian. So we know that you've been doing better each year since.
Yes, I'm doing, as you said before, I'm a 0, and it's still there.
Okay. Great.
And I don't think it's going to change. And it's been good, and I hope it just keeps right on doing that way.
Great, because that was one of the questions in the study, was how long would it last by putting the tissue down there? Next.
It's still good. I'm sure it will last too. Before the study, what brought me in was, as I said, I always heard loud, but suddenly it seemed like the sound was reverberating through my body. It was like a guitar string reverberating on itself. The sound wasn't being handled. And then when it got to where a door would click closed, the metal on metal gave me pain. And it was like I'd be sitting there and I'd go like that, you know.
So you had pain in your ear too from
Yes,
that?
sir.
Okay. How many of the panelists had pain before the surgery? And it went away after the surgery?
Yes.
So that's 2 out of 3. That's 5. That's great.
I think I got better as time progressed, because I let myself do things that I hadn't done for a long time.
Right.
I went to a casino and and I went on a cruise ship, and I would have been really apprehensive to do those things before the surgery.
Okay.
And it really didn't bother me.
Okay.
I noticed a big difference right away, and I'm sure my wife did too, because we just stopped going to noisy places because I couldn't handle it. I'm gonna show you a demonstration here. How many people have done this? Anybody that knows me has seen me do that. I don't do that anymore.
Okay, great. Okay, so what I'm going to do now is, William, why don't you come up since you were number 1 and tell your story to the people. You just stand up here and talking to them.
Well, I had a lot of noise problems with my ear. What had happened was in '92 I had an accident which did dislodge my ears, and also they had to do surgery on this. It busted the eardrum, so they had to go in and repair it. So I think when they repaired this one was fine, but this one, just as years kept going on, it just gets louder and louder and louder until I was shouting. I was literally shouting. People had to tell me, "Don't talk so loud, don't talk so loud." But I was trying to shout over the noise I was hearing in this ear. But since the surgery, I still talk a little loud, but not like I used to. And
Just set it up here.
and it really has been a lot better in the few years that since he did the surgery. it's just got, man, it's perfect. You know what I mean? I hear normally now, which I didn't hear before. So I don't know what else to tell you.
Okay, great. Thanks a lot, William.
You're welcome.
Carol, why don't you come up since you were number 2? And both of you guys are in the literature. We were so excited about this that we wrote them up, and they're in the literature. Everybody has seen the article now that's interested in this.
Well, I started having tinnitus issues prior to 1990, and as time went by, my symptoms got worse. Then hyperacusis appeared, and those symptoms took over my life. I visited many doctors, and there were many both in Boston area and in Florida, but none of them could help me. They all insisted that I go on antidepressants, and some of them, like myself, had not even heard of the word hyperacusis. All the things I enjoyed, like music, movies, driving in my convertible, became physically annoying and painful. Loud noises made my blood pressure rise extremely high, causing tachycardia and a trip to the emergency room. I couldn't stand the voices of my friends and family chatting near me, and I ended up spending most of the time quietly alone. And I needed to find someone to improve my quality of life, and I saw an advertisement for a seminar just like this on tinnitus with Dr. Silverstein as the speaker. After hearing him speak, I made my appointment to see him. He listened to me intently and began testing me for hyperacusis. Then he suggested I consider having some experimental surgery. It was an operation he had performed once before, and he thought he could, he had the confidence that it could help me. After going through many, many tests, and hearing tests, sensitivity tests, CAT scans, and blood tests, all to ensure that I was a good candidate for this operation, especially since I was 75. And I was so desperate at the time to get some relief, I agreed to have the surgery, which was something for me. My ear was done at the Sarasota Memorial, and as we were preparing for the surgery, I felt good that the staff spoke of Dr. Silverstein with great praise as kind of a celebrity and innovator, highly respected. The surgery didn't take long with very little pain and no complications. I saw improvement almost immediately. Honking horns and bike and motorcycles didn't make me jump. And although it's hard to put a number on, my tolerance went up considerably and continued to be better as my ear healed. And I had the other one done. Now I've been able to go on airline flights, cruises, casinos, weddings, graduations, restaurants. A lot of these things I never thought I could endure. Even the high-speed drill at the dentist, without my blood pressure going up. I'm now using the telephone much more now. I can only say there is no discomfort at all. But it is still kind of dependent on how close people are and what the acoustics are in a room, but it is certainly much better. As a result of the surgeries, it was a positive experience, and with Dr. Silverstein's knowledge and supervision, I got first-class care by everyone involved. I was lucky to have found him and would certainly recommend this procedure to all.
Thank you very much, Carol. Larry, you want to talk next?
I'm getting old like the rest of you. I just turned 75 a couple of months ago, and I hope I live long enough for the gentleman down there to 5 or 6 years down the road. Last summer, Rose and I left here to go back to South Bend, Indiana for about 4 or 5 weeks, and the Sunday before we left, I saw this advertisement in the paper, the Fort Myers newspaper. We're from North Fort Myers. And what caught my attention was a guy sitting there like this. So I started reading it, and it would describe me to a T. So I told Rose, I said, when we get back, I got to get a hold of that institute and get involved in this study. Well, fortunately for me and unlucky for her, Rose had to have her shoulder replaced last summer. And we're driving down the road, and I saw her pick her arm up. I said, do that again. So she did it. So I said, call your doctor tomorrow, we're going home. So she had her shoulder replaced on the 31st of July, and we immediately called this institute, and Dr. Wazen, and I think I just saw Dr. Ojo
Yeah.
come in back there, and we went and seen them, went through all the tests, and I'm telling you, the surgery is nothing. I didn't have pain, number one. And the lady said to give their ear a rest that first week. You don't hear anything, because you hear yourself, but you don't hear anything on the outside. And and then you have to put the cotton in your ear and not get it wet. Put the
Vaseline?
Vaseline. Put
Yeah,
Vaseline
Vaseline,
to
yeah.
keep the water out of it.
Yeah.
And that's the worst part of the whole thing. And as
Okay.
I told you earlier, I said, well, maybe I won't have the second one done. But we are. We're scheduled to have it done on February the 9th.
Okay, great. Thanks, Larry. Ilona? I'll have Ilona talk.
Well, hello, my name is Ilona. I have had hyperacusis for many years, possibly since I was 2. Actually, I have a lot of sensitivities, but my sensitive hearing has probably been the most debilitating, annoying, and has had the most impact on my life. In high school, I was overwhelmed in typing class by all the typing keys from the 40 typewriters, the carriage returns, the bells. I, too, walked down this street and jumped out of my skin at every car horn, coming awfully close to being injured a few times. And I do not drive because driving noises are too distracting. In church and other crowds, I had to sit in the back row so as to limit sounds coming at me from all directions. I never stood for standing ovations so that my ears were not close to other people applauding or anything. At restaurants, I requested seats far away from the kitchen, main traffic areas, kids, and usually in a corner where the waitress could not come up behind me and start speaking. Soon I quit going to church altogether. It was much easier to watch a sermon on TV in the quiet of my house. I also had to quit going to concerts, movies, shopping, and dancing. I cannot stand thunder, mowing equipment, fingernails tapping or scraping, and certain people's voices, and soon I had to avoid all of these places. I had to retreat to the silence of my house, but there was no silence. I could still hear the refrigerator running, the air conditioning clicking on and off and blowing, clocks ticking, the wind blowing, birds chirping. My girlfriend said, "Just close your eyes and the traffic will sound like waves rolling on the beach." Okay, so it does. But I don't want to hear that either. I couldn't even drink my Coke without hearing the bubbles bursting in the can. They say, be careful what you wish for. I wished I was deaf on many occasions. I envied people who were hard of hearing. After all, they couldn't hear all this stuff. I even asked one of my doctors when would old age hearing loss set in because I'm waiting. Friends started avoiding me when I snapped at them for making simple noises, and I worried about slipping into isolation and depression because I loved being with people. If only they could just be quiet. They just didn't understand, but heck, the doctors didn't even understand how such excellent hearing was not a good thing, kind of like winning the lottery. You should be grateful. You're lucky. Yeah, right. A friend of mine took me to his hearing aid doctor who was amazed and gave me very good molded earplugs, which enabled me to participate in life again. I was resigned to the fact that this was the best that anyone could ever do for me. Years passed, and I needed replacements, and the doctor had passed away. I went to several doctors who couldn't believe that I wanted to block out 100% of my hearing. One actually gave me earplugs that blocked out 15%. Whoopee! Then in May of this year, I, like this gentleman, answered an ad in the newspaper, like this. Actually, we share a lot in common. I'm from North Fort Myers also.
Thank you.
The response was hopeful. And after the first appointment, wow, finally, people who understood that this was not only a real problem, but there was a real treatment for it. And I had purchased the winning lottery ticket because I never dreamed there was any hope for this crazy condition that no one had ever even heard about. And now I've had the surgery. What a difference. I still hear very, very well, but noises are not as annoying or startling as before, and I have less anxiety. And I'm not constantly on guard for noise or afraid of noise. Mostly my friends and not so friends notice the difference. I get comments like, "You're calmer, you talk softer. I'm sorry I made that noise, but oh, you didn't flinch, so I guess it's okay." And my personal favorite, "You don't know how better you are." Yes, I am better, thanks to you, Dr. Silverstein. I am starting to enjoy shopping, dancing, and outings with people. I went to a concert the other day, and last week I went dancing without fear of the noise. It is so great. It has changed my life, and I'm happy again. I feel I can participate in life again. And may I say something about tinnitus? I had tinnitus. I didn't have tinnitus when I came to see you, though, because actually I went to my GP and I was having trouble with neuropathy. And when she gave me gabapentin for my neuropathy, the tinnitus went away. So I didn't have tinnitus when I came to see you.
Oh, wow.
So anyway, thank you, and I would recommend this to anybody. It is such a life changer. It really is.
Thanks, Eileen. Barbara?
Let me think. Like I said, I always heard louder when I was a child, but then this certain phase in my life when I foolishly got 2 little Pomeranian puppies that bark all the time. And we moved into this home that had a very noisy furnace, and of course, I guess everything was getting louder and louder, where I got to the point of pain, and I was just so grateful to have the surgery. So happy. Thank you, sir. And but everything is not wonderful. I still hear again. You have to understand that I was socially inept most of my very young life. And as you mature, you realize you have to participate somewhat in the world and engage with people. So that's still kind of a struggle with me, but I do that. I think that I will be better. I don't expect any sort of relapse. I just feel very confident about the surgery. I can't think of anything else I could tell them.
Okay, great.
Okay.
Thank you, Barbara.
Thank you.
All right, so we'll open up the meeting to questions. You can ask the panelist or me any questions you want. Go ahead.
Dr. Silverstein, are there like degrees of hyperacusis? For example, I myself, I mean, I'm not to the degree that most of these people have described, but like I get really bothered if I go in and like to a disco place and I gotta get out of there, I can't stand
Right.
it. And in my own home, if a refrigerator is noisy, I couldn't stand it, or I'd rather be hot than have an air conditioner blowing. So, but a lot of other stuff is sort of normal.
Well, it sounds like you have a pretty serious case. I don't know. The way we evaluate it is if you come in for an appointment, we'll do a hearing test and an LDL test that tells you how much level you're at and how much sound you can tolerate. And then we have you fill out these questionnaires, and that also helps us tell how serious and how much this is bothering you.
Can this help somebody, or does it actually happen with some? I think I'm more on the hearing loss side, really.
Well,
but then there's these noises that do bother me.
It's possible you have recruitment that I was talking about, so that we have to measure that and make sure that you don't
So
have
that's
that.
with the person that has
Yeah.
hearing loss?
Yes,
And then certain sounds just...
are too loud, yeah.
Doc, repeat the questions.
Yeah, okay.
I'm curious that many of them, even though they said they had this acute hearing loss, they talk loud. Is that normal, or Did some of you just talk really quiet and your wife kept saying, what'd you say, what'd you say? I agree with her.
That's your boss,
Well, it's not a question, so what's
Did
your
they
question?
talk, were their voices louder before they had the surgery?
Well, that's a good question. Would you think your voices were louder before the operation?
Yes.
Yes, yes.
Interesting.
And, I think it was loud because I couldn't hear myself above all the other noises. Like the phone that just went off now, I'd have to speak over it so that I could hear that I was really talking to you. And if everyone else was talking, I'd have to get louder so that I could maintain my conversation with you, because the others, I'm desperately trying to not hear everything else, so my voice is raising.
So that's really interesting, because people with normal hearing don't speak loud usually, and people with hearing loss speak loudly. And so here you have people that have their hearing sound much louder, and they're speaking even louder, which is very unusual. You know, that's hard to understand that. Yeah, go
I have
ahead.
a question. The man on the left,
Larry.
you said you wouldn't wear your hearing aids because of loud noise. That's what happens to me.
Where's that mic? She heard me state that I took my hearing aids out when I went places, which is true, because it just seemed to magnify the noise. Once I had this operation in my left ear, almost immediately I learned that I could wear. I have them in right now. And when that phone went off back there a little while ago, would have drove us all nuts before this. And it didn't bother me. I heard it, but so did everybody else.
Okay, that's what I was wondering.
Okay, here, I'll take it. And then we'll go to- Any other questions? Yes?
The drug that the woman took for neuropathy that helped the tinnitus, would you recommend that for tinnitus?
That's a good question. We haven't used Neurontin for tinnitus, but it's something to think about. After she said that, there wouldn't be any problem in trying that.
What is the
It's
drug?
called Neurontin. It's a drug that the neurologists use for any kind of nerve irritation or inflammation. Yes?
Is it possible that some of these cases might be genetic? The reason I ask is, I have problems, and I've never been tested, but we have two granddaughters from different children. One is really bad. She's 17 years old, and she's withdrawn.
And what's her problem? She can't tolerate noise?
She can't tolerate noise, just all these things that were mentioned. She just,
So that's interesting. That
Yeah.
it could be, because most of the patients that we've seen have been over teenager years. But it would be interesting to test her and talk to her. Yes.
Yeah, why is it that the hearing got better with time? I can understand why it would improve dramatically after the surgery, but what is the time?
It's not the hearing, it's the ability to the ability to tolerate loud noise improves with time, not the hearing. Right, folks? Right. Yeah.
With me, I do talk loud, I talk louder on the phone, but I have what I call excellent hearing. I can hear everything, but I can't tune things out. Like that fan back there is driving me nuts.
That's part of, I had a lot of that also. I cannot tune things out. I describe, it's like trying not to be ticklish.
Oh, okay.
And you try so hard not to be ticklish, but then when your husband touches you, then you don't feel that either, because you're trying so hard. It's hard to tune out, because that's why the voice, when we were talking about talking louder, it's hard to tune out and still talk. So you're tuning out and you're talking and you're getting gradually louder.
Yes.
I hope that answered your question.
I'm curious, how did you figure out that by plugging that little thing with some tissue would work? I mean,
Well, William was complaining of that sound was too loud to him after this accident. And like I said, I thought that maybe the little bones had been altered by the accident and they were vibrating too much to the sound waves. And I thought if we put some tissue down, it may dampen things. So it's a dampening effect. It's actually, you're putting, instead of putting an earplug in your ear, you're putting the plug inside underneath the eardrum, and you're dampening the sound waves coming in. So just one of those things that, you know, you didn't know what to do for the patient, and you just thought of something, and we said, well, let's try it, and it worked. And then I was looking for 4 or 5 years to find another patient. I couldn't find a patient until Carol came in, and I couldn't believe it. I said, another patient? There must be 2 of you in the world. Yes?
I thought I was the only one that had this problem. I had absolutely no idea. And then my friend here saw your ad. How does Medicare and your insurance handle something like that?
They pay for this. They will pay for it, yeah.
And how young do you have to be before you'll see people?
Well, we have a teenager over there that we hope to get to see any age. It has nothing to do with age.
How old should I? How old before you stop?
If you can breathe, then you can come in. And then if you're above 85, the surgery is an emergency. We do emergency surgery on over 85.
You have a procedure that you put patients through that may be aided by your procedure. Are there other institutes or doctors doing this? And why I'm asking that is because she has a granddaughter, but the granddaughter could be in Arizona.
Well, we're giving a paper at the American Neurotology Society telling all the doctors about this in May in Chicago. So I think after that paper is published, that'll be in the literature, and I give my lecture to 500 doctors that do this kind of work. I think a lot of doctors will be doing it because it's not brain surgery. It's very simple surgery, and most any ear surgeon or ear, nose, and throat doctor could do this operation. And right now, the reason nobody's doing it, several of my fellows that I trained, and we actually have trained 42 fellows now that are practicing all over the country. 2 of them are getting involved in this study, and they're starting to do patients. So I think that as time goes on, more doctors will start doing this. The other reason that this is not being done so much are ear surgeons don't get to see these kind of patients. It's the audiologist. And the audiologists treat these patients for years with noise therapy. And so it's sort of an audiologic problem, and it's not a medical problem that doctors get to see much. But we have diagnoses that the insurance companies will pay. And so
So it will be diagnosed.
There's a condition of the inner ear that's very similar to this that's called perilymph fistula that many years ago we were putting tissue in to stop these fistulas that we thought were in the ear, that the little windows somehow opened and fluid would be leaking out, causing a hearing loss and dizziness. And we operated many patients patching these windows, and it's called a perilymph fistula. It's a standard operation that doctors have done for years. And so we use that diagnosis of perilymph fistula so that they will pay for this surgery, most insurance. Yeah.
Do you use general anesthetic?
Yes, we do it. You could do it under local. It's not, you could do it under local, but we like to do things under general because it's just more comfortable for the patient. Yes.
I have only one sound that I can't tolerate, and that's music. Noise is great because it...
Well, you wouldn't like my jazz then. I've got a lot of songs now, about 61 songs. So.
But I have the same problem. I wear earplugs. I'm like this if I don't have my earplugs, and I avoid places with music, which is department stores, all stores, restaurants play music, the movies. But that's the only thing that bothers me. Noise is great because it drowns.
So this may be misophonia. This may be a fear of certain type of noise rather than hyperacusis. We'd have to come in and test you And if you don't have a reduced LDL test that's in the abnormal range, if you don't have it, we're not going to operate. We're not going to do anything to you. But if you have a reduced LDL and it shows that your ears can't tolerate sound, we can talk to you about it. But it sounds to me that it's not hyperacusis your problem.
What does LDL mean again?
Loudness, discomfort level. Very simple. So what we do is we actually put sound into your ear while you're sitting in a booth, and we raise the sound up little by little. And we ask you to say, when is it uncomfortable to you? When can't you stand it? And the patient raises their hand. And we do it for every frequency that we test the hearing on, from low to high frequencies. Yeah.
In the evaluation, did you do any balance procedures at all to see whether there was any relationship between prior and post-surgical?
We didn't have many patients with a balance problem in
Did you
this.
check for balance?
We did not check. If the patient wasn't complaining of balance, we don't test them for balance. Why do you ask that?
Well, because the statistics say that people over the age of whatever, 65 or so,
Right.
are subject to falls, and 1 in 4, it could be serious and actually result in
Falls, okay.
Loss of life.
Right.
So balance is a significant problem there.
Right.
And there is an association, as I understand, between the hearing mechanism. And
You're
balance.
right. You're right about that.
And so I was curious to know that during the testing that you were doing, whether or not you were asking them that, at nighttime, going down steps, do you have to...
Oh, we definitely ask the patients, but we don't test them. I don't know if anybody have a balance problem. You did?
I got a balance test.
Okay, so you had a complaint though that you were having? No?
No.
Okay, well,
Gave me
Carol
all the
was the
tests
second
I had.
patient and we didn't know what we were doing then. We're testing everything. We're trying to find out what's wrong with her. So,
I have a balance problem. I think it's gotten a little bit better since the surgery, and during the last seminar, there was one guy on the panel who's not here today that talked a little bit about balance. I don't recall what he said though.
he had a tumor in his ear.
Yeah, that's right, and
yeah.
it affected his
Yeah,
balance.
it did.
And you only did one ear on
One ear, because he only had one ear,
That's-
actually.
yeah.
Yeah.
Well, yeah,
So
but
the
I
other
don't
tumor
know.
in the other ear, so.
Yeah.
So, okay, yeah. Are we getting done? We've run out of time. So if you're interested, you can make an appointment. We'd be happy to see you as a patient and go over your problem and run you through some of these tests and see if you'd be a candidate for some of these procedures or whatever else you may need.